Hi, everyone. Welcome to our latest webinar. My name is Harvey Miller, and I'm Director of the Center for Urban and Regional Analysis, or CURA, at The Ohio State University. Really excited to welcome you to the third webinar in the series, Public Data for the Public Good. This series is sponsored by CURA and the Research Commons at the University Libraries. Throughout this series, speakers will discuss the importance and impacts of public data access, use, and preservation. Today we have Marynia Kolak, who will share how a community-centered approach engaging academic and clinical institutions can advance data recovery efforts and data loss mitigation strategies within the context of public health. Before I introduce her, I want to mention a few logistical items. If you require closed captioning today, you will find a box at the bottom of the screen marked with CC. Click the box and select Show Subtitles. This will allow you to view the subtitles during the presentation. During the webinar, feel free to submit questions at any time using the Q&A box, and we will answer many of your questions as we can in the last portion of the presentation. If we don't get to your question, we apologize in advance. Chat has been disabled, so please use the Q&A box if you have any information you want to share with the organizers and, of course, questions for our speaker. As you may have seen in our website, this event is approved for one AICP CM credit. To claim your CM credit, log into the My APA account on the APA website and enter the event in your online CM event log. There will be a brief survey at the end of the webinar. If you have time, please, we encourage you to provide feedback to help us improve these events. If you have any questions following this event, you can email Jordan Swaim Fox, that's SWAIM-FOX.1 at osu.edu. Jordan Swaim Fox is the outreach coordinator for CURA. Couldn't be here today, but he will be handling any feedback, information, questions, anything you need following the webinar. To learn more about CURA's future events or to sign up for our monthly newsletter, which I highly recommend, visit cura.osu.edu. You can also like CURA on Facebook and follow us on X, Instagram, and LinkedIn. And you can learn more about the Research Commons at library.osu.edu/Research Commons, all one word with no space. So now I want to introduce our speaker for today. Dr. Marynia Kolak is a health geographer and spatial epidemiologist integrating a socio-ecological view of health, spatial data science, and a human-centered design approach to investigate regional and neighborhood health equity. She is an assistant professor at the Department of Geography and GIScience at the University of Illinois at Urbana-Champaign, and she is vice chair of the Health and Medical Geography Specialty Group of the American Association of Geographers. Dr. Kolak is also leading the Healthy Regions and Policies Lab and serves as PI on multiple projects, including the Spatial Determinants of Health and PLACE project. Did I get that right? SDOH, Spatial Determinants of Health project, and PLACE project, and also the Localize Opioid Use Disorder, or LOUD study. And she will now speak to us for about 40 minutes or so, and then we'll come back and we'll do some questions and answers. So Dr. Kolak, the floor is yours, please.
And thank you so much for having here. It's really an honor. All right, let's get things kicked off. Okay. All right, so I'll be talking a bit about the urgency of SDOH data. And before we kind of can really get into that, what is and why do we care about SDOH data? And actually, let me just, I just heard a little sound that I don't want to be hearing right now of the Outlook in the background. So I'll just reshare. Okay, sorry about that. Okay, so is it working? Okay, perfect.
We're not seeing your slides right now. You can
Okay.
reshare.
Yeah, I'll just reshare. Okay, there we go. That should work.
Oh.
Yeah.
Yep.
Is it working now? Okay, perfect. So what is and why do we care about SDOH data? At this point, it's probably good to note that I'm a health geographer slash spatial epidemiologist slash spatial data scientist, depending what group I'm in. But at a core, I'm really interested in community context and what drives a healthy community, a healthy population. And so in the US, population health outcomes have not kept pace with other developed nations, despite spending more per person in medical service expenses. This was true before the ACA, the Affordable Care Act that was passed back in 2014, and it was even more true before the pandemic, and though it was starting to get a little bit better, but now there's a lot of research that has shown that a lot of health disparities, so the kind of differentials in health outcomes across different groups has really increased even more dramatically. So why do we care about that? Well, it turns out that what's happening in your neighborhood and what's happening in your community impacts your health. So our team had shown prior that almost 65% of the variation in premature deaths in Chicago could be explained by social determinants of health alone, as well as their spatial footprint. So the term is social determinants of health, not to be confused with determinism. These are more kind of factors that are associated with health outcomes. So here we actually had taken many different neighborhood level factors and developed multivariate indices that were independent of each other, and they're kind of captured here as different themes like socioeconomic advantage, mobility-related factors, so areas that have higher proportions of seniors and persons with disabilities will require different neighborhood infrastructures than younger populations, and so on and so forth. So in this number, we're explaining premature mortality with nothing except information about the neighborhood context and the spatial patterns, not just poverty, but like the spatial patterns of poverty and access to opportunities and jobs and that sort of thing. And that number is pretty consistent. At least half of variation across the multiple different types of health outcomes can be explained by these neighborhood factors, though it does depend. So asthma might be a little bit different than cardiovascular disease and so on and so forth. And it really depends on, again, like the population makeup. So what are SDOH? And so the public health community like to be very concrete. So they think about it as, access to groceries and fresh produce, because if you have access to healthier diet, and you may be able to have better health outcomes. But that, of course, as geographers, we know that that's really related to, well, do you have time to go to the grocery store and cook for yourself, right? Public transit, jobs, all those things will kind of interact with your access to the resources themselves. And that will kind of follow across a couple of, several different topics. So some researchers will just focus on access to green spaces, which have known to have an association with mental health. And there's other factors that are, there's also associations, but it's not clear if it's necessarily causal or driven by kind of a combination of forces. There's classical things like, hey, can you get to the doctor when you're sick? So that was a huge issue when many rural hospitals closed over the past few decades and the pandemic hit, right? And then education, quality, tutoring, a lot of these factors are really so strongly correlated with jobs and income levels that in a national level analysis, you can't actually tell the difference between educational attainment and like income levels, because the data is so strongly correlated at the neighborhood level. And within public health, the theoretical framework that many folks will use, and there's many different types, but so the socio-ecological model. So some of you may have already seen this. The idea is that, yes, like individuals will have these factors like your age, sex, gender, other kind of constitutional factors, your genetics, that's under the skin, but then you have all these other factors above the skin. So your behavior, your individual lifestyle. Do you wake up early and go on, hikes or this is not me, obviously. So I've heard that people will work out every morning, right? That's a different behavioral lifestyle than someone like me who might like to just do, yoga or hike once or twice a week, okay? And then there's social community networks. Do you have social supports? If you're stressed, do you have folks that you're speaking with and supporting you? And then there's community level factors. Again, work, education, unemployment. While there's a lot of research that has just independently said we know these things are associated with health, it turns out that the measurement of these at the neighborhood level still needs a lot of work. So that's kind of where I've parked my methodological boat for my career. I won't talk about too much about that today, but I'll just say that, there's many different ways to measure these things. A lot of the, like for example, education, work, and unemployment, those three factors just in these diagram are so strongly correlated with each other that algorithms can't necessarily tease them apart in a national, sample. But there's other factors like water and sanitation infrastructures that can be very spatially heterogeneous depending on local policy and what's available and that sort of thing. Same with housing, which can vary at a very small, metropolitan or like sub-metro area, block by block. Healthcare services, which are really influenced by policy, and so on and so forth. So our team, again, we study this. We're really interested in measuring these factors and then seeing how, if we can measure something at the neighborhood level or regional level, how does that actually correlate with what people are experiencing individually? And if they're in like what, like the differences might be really interesting. So if someone's extra healthy in a neighborhood where we might not have hypothesized that, there's probably something else that we're missing. So trying to understand those differences. And so as a result, a lot of, because we're an open science lab where the goal is whatever we're doing is for the public good, a lot of our different projects, we provide all of that data for free. Whatever can be publicly available that is not protected data, which most of it is not. Most of it, the data we work with is publicly available. So we run the Opioid Environment Policy Scan, which is a national level data, like it's a huge data warehouse. And at this point, data ecosystem where there's measures at social, environmental, policy, economic kind of factors at census tract, zip, county, and state level measures in order to understand the environments that can support, positive outcomes for persons with opioid use disorder. At a very local level, our team runs the Chives project, or we manage it, I should say, because it's actually a data collaborative and a mapping collaborative where the structure was set up so that folks can share data through a Google spreadsheet. That data gets linked in, joined to Chicago level census tracts and made available so that anyone can access this kind of communally supported data set with factors from air quality, research outcomes, or biodiversity measures, or a series of more kind of social economic factors that contextualize those things, as well as increasingly community stories. That's kind of like the next leg. And then, of course, we also had a pandemic dashboard, but it still is open and available, so you can explore the whole pandemic throughout from day one to the end of where data was reliably being shared. So these are different projects that our team had already done. And then back in 2022, with the Robert Wood Johnson Foundation, because our focus is really the social determinants of health, what are community level measures, for me myself, I'll be an encyclopedia of information about this. Someone might ask, like, hey, I want to study green space in this area. What data should I look for? And based off of other projects and just being like, in this space, you can start to run off the different options that are available. Food access, green space are really common things that folks are interested in, access to clinics, but also a lot of other things, right? So the goal was rather than just a few people having all of this information in their heads, like we can probably share this in a better way instead of going to, because people would ask, like there has to be a site where all of this is available to see what's available, all of the options are available to you. So that's really where this project came in. We wanted to make data about the social determinants of health really at a community level, because there's already a lot of work that's done on looking at SDOH at the individual level, like my specific job, whether I specifically have a car. Okay. That is generally done through HR systems or electronic health record systems and surveys. But what we're interested in, what other folks are interested in is what's available at the community level. So we wanted to make it easier to find, easier to use, and then also easier to understand its utility. So for example, with green space measures, a lot of folks might initially start to think, okay, I want to know where the parks are, but well, how do you measure a park? Do you take a point? Do you take a polygon? Which park data set are you using? And then is parks really what you mean by green space? Maybe you want to do kind of a preliminary analysis on like actually green spaces like NDVI, which if you're coming from sociology, you've never heard of that term. Then, it's a satellite measure. And if you get really into it, NDVI isn't quite sufficient enough. So it can get more complex, and you might want to do a street view level data set from or there's a Hong Kong group that provides that for some cities. So there's a lot of complexity here. And because most of the SDOH data that relates to communities, neighborhoods, and regions is really access to spatial data, now we're talking about new formats. Many researchers in public health, sociology, other fields are not used to working with, or only used to working with CSV formats. So, what's a spatial, what's a, .shp file, what's a GeoJSON and that sort of thing. So the goal of this whole project was to make all of that easier by connecting across disciplines, being able to provide things that impact communities more directly, and so on and so forth. And one of the reasons for also creating a central place to find data about the social determinants of health is because currently the data is split across multiple, generally siloed programs and systems. And again, they take years to master. There might be data portals. There's a national census, but there's also county health rankings. The city health dashboard, which provides amazing data at the census tract level for a huge number of metro areas across the country, as well as the COVID Atlas. So the three right here that I just talked about are all Robert Wood Johnson Foundation dashboards. But and we actually had tried to link the data across those, but there were a variety of challenges. Not technically, we can do it, but it's like the consult, some groups are managed by consulting groups, other engineers are working in-house, and it's the people and the politics that make it really difficult. So where we started back in 22 was we were going to and so I'm not going to talk about too much about design today, but we found that just bringing in human-centered design thinking in data applications when you're starting to, work with SDOH data and then communicate that back to the community, to whatever community you're working with. That could be researchers, policymakers, or community advocates. Doing it, thinking about how people actually prefer to access data is really important. So we've just brought in one approach, human-centered design. There are many. We also created a new data discovery search tool that will become central to what I'm talking about today that includes data about place and social determinants of health. We created a toolkit for folks to learn how to work with that sort of data and then make their own web application. We had a fellowship, tested toolkit, build community. Throughout that whole process, we also found that human-centered design work was really great, but sometimes not enough. And when we were working with community partners directly, design justice was kind of like the next, phase of that. We also found that just creating places for people, and the places could be virtual, formal, or informal, but especially in-person places seem to be the best. Creating places just for people who are working with SDOH data to talk about it. And share resources was really valuable, especially when people are coming from different interdisciplinary settings. And then, of course, we did the research stuff. We published, or the book should be out in a month, a book about social determinants of health and place. We're starting to build research guides that tell you, like, step by step, if you want to measure green space, here are your options, and that's still building. And we also uncovered multiple research gaps and how the knowledge about community level SDOH data is stored. That's a whole other talk, but anyway, then January 2025 happened. We're about to start the next 2-year phase of the project, and massive changes start to happen with the new political administration, where a lot of the data that had been available before suddenly is not there. So several of you might have seen pages like this, right? Page not found or temporarily unavailable. So data that had always been on different websites since it was generated through multiple political administrations was suddenly not available. So the Great Purge. What started this? So January 20th, Martin Luther King Day of 2025. The new administration issued a series of executive orders. And I think it's important to, so a lot of the information for the next few slides is from a legal briefing, or sorry, not a legal briefing, peer-reviewed literature related to, like, within the legal studies. In epidemiology, policy is super important, especially for some of the research that I've done in the past. So I've learned that some of the best information will come from legal scholars when it comes to this kind of work. So legal epidemiology is a thing, but in this case, it's not epidemiology necessarily, but it's something more broad. But we have these two executive orders, 14168 and 14151, that are specifically targeting gender ideology, quote unquote, and DEI, or diversity, equity, and inclusion programs. And these two are passed, and what follows from the main office are specific directives to clarify the types of agency data purges that will be required following these two executive orders via presidential orders. So terms like gender ideology, transgender, LGBT inclusion, pregnant persons, and other terms on federally agency websites are expressly prohibited. So that happens on the 20th. And then on the 31st, entire public health information sources were taken down to comply. So this was the time that had been given, and by this time, a lot of things had been removed. Sometimes it was data sets, sometimes it was just information about things, like information about assisted reproductive technologies, Alzheimer's disease treatment, social vulnerability in emergencies, vaccine guidance for pregnant persons. A massive surveillance data set for HIV was removed. The social vulnerability index and the environmental justice projects were taken down, or at least one of them. No, sorry, I take that back. On this day, both of them were taken down. Guidance on assuring diversity of subjects in research trials. So a lot of guidance was taken down. And this also related to things like guidance on providing the best medications for sexually transmitted diseases. There were also things like the National Distress Hotline that was removed because of the terms in how the word or specifically on treating women with opioid addiction, as well as data on domestic violence, LGBTQ plus hate crimes, and experimental medicine. And again, it's because these terms like inclusion, other things had been stricken across these different sites. And so this is a really great article that's an national or NPR, a news agency that was also recently lost some funds. This kind of provides a step-by-step kind of overview of the timeline, which I highly recommend. So by February 6th, some things had been returned, but others were still down. You'll see this article published in February 11th at the BMJ Journal. that's really highlighting how I think the term like this, the speed and the audacity of a lot of the data purges that were happening. So by February 11th, lawsuits were filed. So one lawsuit specifically that's really important to this story is the one by Doctors for America, which is a nonpartisan group. They specifically sued OPM, Human and Health Services, the CDC, and the FDA in the federal district court. By February 11th, there is a temporary restraining order in favor of Doctors for America. So related to this specific lawsuit, several websites and data were restored, but not all. And there were some updates to that, which I'll show you in a minute. And then I just looked this up. So just on July 3rd, it was no longer temporary. So a federal judge ruled in favor about this. So today, several websites are up, and sometimes they're up specifically because of that lawsuit on February. So here, if you look at the Youth Risk Behavior Surveillance System website, this is a program that is, it's one of the one of the most important data sets that exist in public health. It was really critical also. So it looks at behaviors of youth and has a massive like peer-reviewed, like really excellent design, like really, really well-designed survey approach. And among other things, it's done many, many things, but one of the most things it was critical to highlighting was that it proved without a doubt that youths who identify as LGBTQ plus without a doubt face greater health risks than their non-LGBTQ peers. So that's one of the reasons why this was probably targeted based on the understanding. And even today, if you access this, you'll see in this yellow box really specific information about, so yes, like this website is up, but we didn't want to put it up and we reject it. So however, it is still up. The EJ Index website, Environmental Justice Index, is also up and also has that same kind of note. However, there are several websites that are still down. And again, note that those websites that were forced to be back up were probably referenced in that initial lawsuit. But there are other sites that are, still not available. So here's the Social Vulnerability Index website. You'll see something similar if you try to look for EJ Screen, which is a different data product than the EJ Index. And so there's a lot of questions of like, well, what's the quality of the data that is up? And so in a like hot off the presses earlier this July, I believe, there was a study published in Lancet that reviewed the metadata from HHS, CDC, and Veteran Affairs. So they just looked at a couple databases, not all of them. There's many other agencies that were impacted, but they just looked at 3. And they looked at the metadata of different sources, and specifically between January 20th and March 25th, which was kind of right in the middle of that really crucial time period. And they found that about half of the data sets had been substantially altered. The most common kind of update was changing terminology, which if you're working in the biomedical field, in an evidence-based program, the difference between sex and gender can actually make a pretty substantial difference in the study results and that sort of thing. So important to note. So I highly recommend checking this out in this study. And there's also evidence that it was not a consistent change across time. There was about 4% of the changes happened between January 20th and January 31st. A bit more happened in February, and then about 72% of the changes happened in March. And again, this is just a cutoff date of when they stopped their data analysis. And since then, there's been, so again, there's kind of there's a two-pronged approach of looking at gender sexuality and diversity, equity, and inclusion. So there's some notes that the ban on data collection, so the issue is not only was data no longer shared, but what about continuing data collection on different projects? And that is not going to be happening for some different projects. So there was a a change to federal surveys that was happening. In the literature, Mayer refers to this as the lavender purge. Um, and also highlights in his work how past insights into differentiating and understanding sexual or gender minority persons. We've had some really interesting science emerge from that impacts people directly. So it's been clear from past research that differentiating those things are important so that care providers can have more specific trainings to provide optimal care. And optimal care, refers to the best health outcomes possible. Also, it's been shown that LGBTQ patients, especially if they're younger, will not provide information about their behaviors if they're not asked, which is different than their non-LGBTQ peers. And then this can lead to a lot of missed opportunities for cares and prevention. There's also a need to greater understand the role of discrimination and stigma in seeking and retaining care. So we see this a lot in the opioid space, where residents in rural areas may not seek care because of the stigma that they experience when they're seeking care. So this discrimination and stigma can refer to a lot of different things. And especially when you're looking at different intersections of if you are also a minority on top of that, of multiple different groups, that can really like amplify the impact and that sort of thing. And then here's the article from AGPH, kind of referencing that that the data collection was from the most, erasing gender identity data collection from some of the most rigorously designed large population studies as policies. So that happened, and at the same time, policies were removing protections for young transgendered people. So some public health folks have said really clear, like, is this the coordinated strategy to erase these people, right? So that's where that term, the lavender purge, comes from. And of course, this is just one of much bigger topics, but several of you may have been impacted by this directly. There's also changes to not just to websites, not just to data, but also to the people who are working on this and to the studies that support it. So this award, no longer effectuates agency priorities. And again, from a scientific perspective, we know that a lot of this research actually shows really high returns on investment and actually does enhance health, years of life and improving health. So it's not an evidence-based approach. So enter back the SDOH in Place project. So we were already, our lab kind of focuses on measuring social determinants of health. In last fall, over the last, from 2022 to 2024, we had developed this master list of critical social determinant of health data sets. Some of them were from third-party groups like County Health Rankings out of Wisconsin, but others were from, a lot of the other data sets were actually from the federal government, because taxpayers had used, had made that data available to the whole country. And actually globally, right? So we had already developed this master list of data sets for researchers, health practitioners, and advocates, and had been working on generating metadata for the discovery tool, which I'll show you in a minute. On January 31st, it was a Friday, we received a tip around 2 to 3 p.m. that data would be removed from multiple data websites. So we used the list that we had been working with for the past few years to activate massive downloads of the data from that day. And then in February, this this collab turned into more of a collaboration where we worked with UChicago library team members, where they had the goal is to kind of amplify the efforts and to have as many copies as need to exist everywhere and anywhere. So they developed kind of a parallel metadata stream and started to also contribute to the data resource collection. We also worked with an Illinois regional clinic and health research team that specialized in a different so they specialize in more individual level measures, but that's really connected to the community as well. So they took the lead in kind of prioritizing some additional things. And then in April, we received a tip that SAMHSA, the kind of substance use arm of, well, and mental health as well, that a lot of the data there might be or would be removed. So we kind of reactivated all of those teams to archive additional data. And so here's just kind of a nice little Padlet that highlights all the different data that we have from in the SDOH in Place project. However, the recovery efforts we have go way beyond the data that's public, like that's within this search tool. So we do kind of see them as two separate but complementary things. So for example, you can get track level measures on air quality and ozone and a lot of other things from the CDC National Environmental Public Health Tracking Network. You can get really great data on jobs and workers via not just through the different economic surveys, but also through the US EPA Access to Jobs and Workers tool. There's also a really great walkability index that is a great start. Several of you are probably experts in measuring walkability, so there are improvements to be made, but it's something, right? And then, of course, the CDC Social Vulnerability Index, the EJ Index, and so on and so forth. And also down here, you'll see the Food Environment Atlas. There are also great measures on measuring, or there are great kind of beginner level measures for measuring like food deserts or so-called food deserts and food access. And those data sets went through actually like two different rounds of major improvements. So there's two separate names for those programs, and they correspond to different time periods. So the good news is that a lot of the data that had been taken down has already been integrated in a lot of other research and data that is made available to everybody. A lot of it came from the census, like even the social vulnerability index. Those are all census level measures, and the methodology for that is also available. So recalculating that is straightforward. In county health rankings, city health dashboard, congressional health dashboard, these are all projects that are independent of federal administration guidance. So you can access those things. And then census resources, Minnesota, protect Minnesota at all costs because they do a really phenomenal job recording all of that historically, right? And here you can see our temporary box location. And it turned out that there's a lot of different, very fancy ways you could access this, but we've actually continued to keep it in this format for now because a lot of the folks who are using this from our different projects really prefer being able to find it this way. So we're data users, and we kind of try to optimize this in a way that data users would want to work with. And I think that's one of the reasons why sometimes simple can be helpful. So here, places is a track level data set of imputed. It's imputed. It's not real. It's a modeled data set of health outcomes at local levels. So we include all of that organized by time period and spatial resolution because we know that's how a lot of folks will actually use the data. And you can see here too, like this specific day that it was downloaded. As a white woman in Illinois and the PI of the project, I can take on the risk of having my name on this. So there are a lot of data sets, especially as you drill in, where the names have been protected because as a leader of a lab, it's a little bit different than other folks who've been working on it. So here you can see the Environmental Justice Index. That was a new project from 2024. This was actually a data set that was archived by the Environmental Data and Governance Initiative team. So rather than us replicating that, we just link to that and provide some of the metadata and so on and so forth. Okay, so and then we're also adding archival links to the data in the SDOH platform, which I'll talk a little bit more about. But first, a little bit more on data recovery efforts. There's a lot of other, this data action hub seems to be the most commonly referenced. Our site is not on here, so there's a lot of, it's not, all inclusive, but you'll also see groups that, like Policy Map is a really phenomenal product, but it is a business, right? And So yes, they did add this feature here, but it also is a business. And you'll also see some groups here. There's a lot of like national, level organizations, and they'll focus on really specific data sets and or some other things. So this project specifically, it may take a while to find the actual data set that you need to work with. So the audience is going to be a little bit different than the project that we've worked on. And then from that same author, Code, they just came out with this really interesting full report about all the work that, the data recovery works that had happened, data future, looking at data futures and that sort of thing. But I just wanted to call out too that their first recommendations were to engage with the executive branch on positive reforms, which I think is delightfully optimistic and then also aligned with administration's AI goals. But I think if you really, my personal opinion is if you really look deeply at the step-by-step process of what happened, that would not be my first recommendation. And it's also, it might put some people in harm's way. It might put, depending on who you are and what your focus is, I might not recommend that you specifically work with the executive branch to bring this data back. Okay, but there's also a lot of really other great recommendations in that report, but it just really highlights the complexity and the challenges in accessing SDOH data with recovery efforts. Each recovery project had their own focus. Not all the recovery projects were done by folks who actually work with the data. So sometimes there's a lot of tricks and details when you're like working with a federal data set. They're not always super clean. So you also, you often need to find metadata and content around the data set. So we, in some of the data sets, grabbed the web pages and the documentation, the technical documentation, which is where a lot of the knowledge actually is. And then, for data users, where do you start? Where is the data that you need? There was one website, I believe, an archive.org that had all of the CSVs that were pulled off of the CDC, but you would need to know pretty precisely like what the name of your CSV file is before you'd be able to get a lot of meaning out of that. So there's data, but there's knowledge and there's meaning, and you need to kind of think about a couple of those things for true data recovery. And then also the funding and ultimate goals of the recovery effort is not always clear, and transparency is crucial because right now there's a natural kind of flow where privatizing SDOH access is very tempting, right? But there are a lot of challenges that are associated with that as well. But back to just for a few minutes, I didn't want to, I only have maybe less than 5 minutes. So just briefly talking about the data discovery project that our team had worked on with the SDOH in Place project. It's really the heart of our work. And in addition to the other things that I had already talked about, and we really wanted to support folks who work with place data to make it easy to find. And this is really what it looks like. So I'm going to just dive right into it. Here are all the data sets. So for example, if we look at, there's Child Opportunity Index, which is a different data set than Child Opportunity Outcomes. But for example, let's look at the places data. Okay, so if you look at places data, you get all this information, but then you also have usage tips. So because these are modeled and not direct estimates, don't use them in a regression, probably. So that's a common thing that I have to do as a reviewer is highlight that. And then the other part, because we work with data, we know that folks want to know what the data is. So we include the variable names. And so on and so forth. And we also include specific data inputs that might go into some of the outputs here. For another one, let's look at food. Like food access is a really common thing. You'll find there's the Food Environment Atlas, but then there's the Food Access Research Atlas. And if you were to go to the website, maybe it's up today, maybe it's not. If it's offline, you can also check the link to the data archive, which links back to here with some of the corresponding measures. We also include links to the technical documentation and like the official archival. And we're continuing to refine this and make this better. So we have There's a website called Research Rabbit, which generates like a social network of articles related. It's kind of a amped up lit review. So we've been developing profiles for each of these data sets. So you can see how it's actually been used in the literature or not, and so on and so forth. And there is also an AI feature because that's how our team works. So, how do parks influence health? I might ask a question like that if I'm starting um, at the very, very, beginner level and I really need just some brainstorming. You might switch to our, well, here, I can even just do this to save some time. I can just, put that in. This information will actually get, this question gets put into a ChatGPT query, and then the output of that query will be a number of, oh, 1 second. I think that the quotes were messing it up. But basically, it will generate specific search terms that will make sense for what we're looking for. Okay. All right. It looks like I broke it with, so I'll have to work on that later. This is where I say that this is a work in progress, right? Okay. So this project, but honestly, it works in many other cases. So this project, and in the map that you saw, you can also zoom into the map and the search, all the data sets will change depending on where you are, because not all data sets, so all the data sets are for the whole US, but some data sets might not be available for rural areas, like the city health dashboard might not include an area. So you can zoom into your area and filter by that. That's really inspired by GeoBlacklight, which is a library GIS software used by a lot of different groups. On the metadata side, this is what that looks like, where we have a way to kind of add and update the metadata. This provides references that we can use, and these are all kind of standardized metadata factors. Adam Cox, who some of the folks here know, was really instrumental in developing the pipeline to work with us. And beyond that, we also do a lot of work with design. So who are we anticipating will be using this product? So we created profiles for advocates, analysts, researchers, policymakers, and worked with those and had a series of design activities, like a design sprint, a lot of user testing. And even today, there will be, we're still taking feedback. So the fact that there's not enough search terms coming back up now, that's going to be reported so that we can get that updated. And then what you're just seeing, that LLM aspect, is kind of the more experimental aspect of this work. And it's to kind of make things even more interesting. And it's essentially mining the massive database of metadata that we have to look for information. And, spelling errors are forgiven and a lot of other things. So with that, there's a lot of different directions we'll be going next with this project, including building out an SDOH ontology to kind of better guide the search direction, because there is so much about how SDOH terms and concepts, how they're organized, that is not understood by an LLM. And so we're developing an ontology to help guide that process, and we'll be doing that with community engagement and expert engagement. And that's it. I'm a little bit over, but hopefully there's still a good 12 minutes left for questions. But I'll stop there.
Okay. Thank you very much. Really interesting projects. I've been taking notes and mining URLs and everything with everything you shared. So that's really terrific. We have some questions, so I'm going to turn over to Josh. I just want to remind people in the audience that if you have questions, just please put them in the Q&A, and Josh will answer some of those. Just a real quick question to get started, maybe a couple questions. I'm really interested in this concept of design justice. And I'd like you to first of all define that for us, but also tell us about one of the things that really strikes me is that it's already was hard enough to find data that's fit for use in formats that people could use, especially considering the heterogeneous audiences out there. This whole all these disruptions is making it even more difficult. So how do you really approach that problem from this design justice perspective? You showed us some examples of what you're doing, but what's the kind of way of thinking about it?
Yeah, I think that the fundamental in design justice, I probably don't have a single definition for that just yet. In a few months I will, as we're working on a paper to kind of explode that. But I think the fundamental principle is this belief that it kind of especially the folks who are closest to the problem or closest to the solution and understand the problem the most. And so when we're working with community groups on developing a web application, seeing them as experts and equal and in their ability to kind of contribute to that web application in many different ways, which is um, which is a process, I think, for everybody, because I think in the reverse, there can be intimidation from the community of do I know what I'm doing? Like, are you, you're the expert. But on the flip side, more often there's kind of maybe a resentment of the expert, like the academic expert coming in and telling them how to fix something, right? That's usually the kind of and and so I'll say, especially now, I've found that oftentimes like researchers will be less sure of what to do, but I've been finding guidance from community members where they're telling me like, we've been working, this has been like, this is just one of the recent changes that have happened. Like we've been fighting this fight for decades of advancing justice and making data more accessible and that sort of thing in different ways. So I've really learned to kind of slow down in my approach and not start analytically, but start with building relationships, having a lot of time dedicated to just listening. Listening is really important. And like with the toolkit, we've developed, approaches to like, well, yeah, if you want to make a data dashboard, here are the steps to work with that. We don't actually get to app development to the last slide because the first several chapters are, thinking about what you actually want to say, thinking about the community that you're building this for or with, and kind of going step by step through those pieces. And it's interesting because we've done this toolkit with both researchers and community groups. And researchers have a harder time at the start because they're not used to thinking about it in that way. Whereas community groups are really excited to delve into like, okay, we really understand this problem exceptionally well. And then it's just a matter of scoping out the plan and then finding the time and the funds to support the actual like, implementation later on.
Right. Hey, Josh, we have a couple questions in the Q&A. Why don't you go ahead and take that?
Yeah, sure. So first, Marynia, I just want to say, thank you for sharing with us today a bit about your team's approach to these really important research topics, but also your approach to developing what seems like a really great discovery resource. So on that latter front, we have a question from an audience member. A lot of your data rescue efforts sound similar to locks or lots of copies keep stuff safe approaches for library serials. However, with data, it seems that it's important to save the data, but also capture methodologies and or user files. And so how might you be tracking like use of the data that you're facilitating access to? Are there concerns about publicizing discoverability, especially in a political environment where that's still a hot topic?
No, yeah. So I don't know about that specific language. So if they can chat me that would be, I think that like their team would be super interested in that. And yeah, I think but there are many data recovery efforts that will be overlapping and repetitive. What I've learned is to celebrate all of that because the more copies there are in different formats and ways, the better. Yeah, so there's that. I think that, yeah, and there's still a lot of problems that haven't been fully resolved. So for example, like a lot of different universities will have ways, because we've still kind of thought about this too, where, do we just put it all into a server? Well, then accessing it the way that it's needed doesn't quite capture things. We also thought having like unique DOIs for each data set would be important. That's kind of the approach that other groups have taken, like that environmental one that I shared, where they put it on Zenodo and got a DOI number. But there's still pros and cons with some of those pieces. And like, so every university or not every, many big universities especially will have ways to like store data locally with the full metadata. And like, it's usually done for research products and data products that came out of that university, or in some cases, papers or dissertations or theses. We looked at that because U of I also has something like that, but after more discussions, like it wasn't really designed to carry data from a different source. So that doesn't quite, long story short, that's why the data is still in a box, because we're finding that that's like, if we like, do you do a lot of work to make something less accessible to the end user? Like if you add a lot more, so there's this like fine line between structured and unstructured access to knowledge that we're still navigating. Um, and then as far as how that information is stored, we're not tracking that because it's like none of our business, if that makes sense. Like we want if and we've been publicizing the work that we've done without a problem, because again, like I'm a white woman in Illinois, it's a risk that I'm able to take that others can't take. So I'm okay. And this is the best part, is I'm just a geographer, right? What do geographers do? What do they know? So it's the first time in my life that being a geographer, and others not knowing what geographers do is kind of beneficial. Um, you know.
Well, I think this next question maybe will draw a bit on your geographer expertise. So we have another audience question. Thank you for your talk. In many studies, spatial access to resources like healthcare, food, or parks are measured at the census tract, block group, or zip code level. But these aggregate metrics may obscure the individual constraints and lived experiences that shape actual access, especially for vulnerable populations. So how do you think we can move towards more user-centered, experience-driven measures of spatial access? Do you see these approaches as complementary to aggregate spatial measures, or do they represent two fundamentally different directions?
So I love this question, and I love this question. So I would say 100% they have to be complementary. We'll never have the resources to have individual level surveys of every human in the country, and that their experiences will change constantly, right? So on the one hand, we can't scale that to a national level, but on the other hand, there are signals that we can capture from the aggregate level as well. So a lot of the work that I do will be in really rural areas where block level is not like a lot of the spatial access research is focused on urban areas, and it really misses really important patterns in suburban and rural areas where the spatial aggregation is actually much bigger to make a meaningful result. So what I do is I partner with folks who are great at qualitative analysis, and I highly recommend this for everybody. Is where it takes a team, right? Like our team will focus on developing really good aggregate measures, and we're consistently refining those measures and trying, and like now we're testing, for example, like a conceptually driven approach versus a data-driven approach with community feedback with folks who have lived experiences. And then we're going to test that with community and individual level actual outcomes to see how close we get. And I think that's where the science is it's not just a GIS topic. It has to be kind of complementary.
I think we may have time for maybe one more question. Um, and maybe I'll ask that. So you talked a little bit about, the idea that there was recently kind of a study of alterations made to metadata for some of these publicly available data sets. And, what are maybe the practical implications for that you've seen so far, either like for your own team's use of those data, or, how you're thinking about others might use those data?
Wait, or can you say that again?
Yeah, so the alterations to the metadata that were uncovered,
Yeah.
what are the practical
Mhm.
implications for people using those data sets moving forward?
Yes, and I think, yeah, and there's several different challenges that come from that. Yes, so I think that poses a lot of challenge for working with data today that is being updated and made available today on different federal websites. I think a lot of this gets into really specific, like personal, legal, political, and even administration level decision making. For example, I have had PhD students who, even though we have a copy of the data that they need, they're like the administration won't, like the education administration won't trust, like you can't trust the copy, even though it's not from it's not from a malevolent actor. But a lot of rules suggest that it has to come from the federal database and logged on that day for it to be used. So that poor student had to completely change their dissertation in the last 2 months of finalizing that. So I think that it depends on like the stakes of what's involved. Like, are you making policies and regulations that will impact people? And if that's the case, then you have to be extra careful with what you're working with. For a lot of other work, I think as long as we're being transparent in how we're accessing the data, like I'm still going to be publishing with data archival copies, right? Because I trust the process of how it was pulled. And you can also double the fact that there's copies, you can actually check to see if the data is consistent across those, right? So it's still possible to do it, but it depends on the stake situation. I think I'm more concerned about the lack of data collection and a lot of things going forward. And I think realistically, we're just going to have a gap in our data knowledge. And I just don't see a way around that at this point.
Yeah, that's a really challenging problem. I'm glad you ended with that question, Josh, because when you have multiple copies of a data set and metadata could have been altered, data itself could have been altered, which is the authoritative copy after a while? You don't know, and there's no real way to check that again unless you check it against reality, of course. So it's a real challenging issue. We have to end there. Great discussion. Thank you very much. And I just want to let our viewers know that our next webinar in this series, Public Data for the Public Good, will be on Friday, August 15th at 12 p.m. Eastern Time with Joy Banugaro. She'll be talking about lessons from a public sector chief data officer. She was the she was a chief data officer for the state of California and for the city and county of San Francisco. She, in fact, she created the chief data office for the state of California. So she'll probably have a lot of very interesting lessons for us. So I encourage you to tune in August 15th at noon. Again, register for our talks. You'll also get a copy of the recording of this, which we post on our YouTube channel. And we hope to see you on August 15th. Thank you all for joining today and have a great weekend. Thanks.